Welcome, I'm the dentist. In our Dentagenda, we will be continuing the first chapter, History Taking and Examination, Part 5, Radiology. In this tutorial, you'll learn about advanced imaging techniques. These are the points included in this chapter video series. Radiology. In this tutorial, we will discuss advanced imaging techniques. You'll get to know these 7 types of imaging techniques. Number 1. Computed tomography or CT. This type of imaging technique uses an X-ray beam that is emitted out of the machine in the form of fan-shaped X-ray beam. This beam moves around the patient in a helical or spiral movement, and it scans sections of the body. The images that are scanned using that beam should overlap, so the successive layers should partially overlap so that the computer can reconstruct them into a cross-section image or a 2D slice. And this is the shape of the machine. It is quite similar to that of the MRI as well. Number 2, cone beam computed tomography or CBCT. This is another form, the more advanced form of the CT imaging technique. The main difference here is that the emitted X-ray beam is in the form of cone, not fan. The cone covers a large area of the human tissues, and that's why the reconstructed image by the computer is a 3D image, but still can be used to view slices or 2D images as well. The scanner rotates around the patient in a full circle once or maximally twice. During that, the scanner can form up to 600 photos or slices that are together forming the 3D image. The patient should be placed between the source of the emission of the X-ray and the image receptor. The person can be standing or seated depending on the situation. The most important thing is to adjust the interpupillary line and the ala tragus line according to the machine instructions. CBCT is widely used in dental field and most preferred over the conventional CT due to its multiple applications. You can use it to locate impacted teeth before surgically extract them, because you can precisely know the position and the angulation of the impacted tooth. You can also locate the infraalveolar nerve and canal to avoid injury. You can use it before orthodontic treatment planning, and you can use it before implant placement. It not only allows you to measure the depth, width and height of the bone, but it also allows you to measure the density of bone in the aimed area, and then you can place the implant digitally and see how will it look as a final result. It's also very useful to construct and design guides in implant guided fabrication, and as well as full mouth rehabilitation, and in case of endodontic treatments in case of the complex root anatomy. Cone beam computed tomography has many advantages that makes it more favorable over the other imaging techniques. Firstly, the lower cost compared to other methods. Secondly, a short time is needed to take a CBCT image, can be as short as 30 seconds. The exposure dose is very little compared to other methods, and especially the conventional CT. The resultant image can appear in 3 different planes: axial or transverse, coronal, and sagittal views. You can also use them in digital measurements and planning for implant placement. it is so feasible for the patient education as it is a 3D image. And of course, you can specify the field of view that you want to image before taking the radiograph. And that is important because the smaller the view, the lower the dose to the patient. If we can compare between the CT and the CBCT, these will be the differences. Firstly, the emitted beam in the CT is a fan-shaped X-ray beam that moves around the patient and takes single slices per scan. In the CBCT, the emitted X-ray beam is in the form of cone that can take a complete volume image in one rotation. In CT, the fan-shaped beam moves around the patient in spiral or helical method, and that takes a longer time, but it is a must because the slices need to be partially overlapping. In case of CBCT, it is much quicker and no need to overlap the slices because it's a full volume image at once. CT has a higher dose of radiation that can reach 1200 or 3300 microsieverts, unlike in CBCT, where the lower dose is about 36 microsieverts only. In CT, only one jaw can be scanned and visualized at a time. In CBCT, both jaws can be imaged as well. In CT, there is a high contrast between hard and soft tissues, and the resolution is better, and that's why it's a higher cost technique. In CBCT, there is a poor contrast, and that's why the soft tissues are not in the best quality, and as well it is available in lower costs. In the CT machine, the patient can suffer from a claustrophobia, but in that case the patient can be offered a headset or goggles to distract them, or a very low dose of a sedative medication. In CBCT, the machine is open, and that's why it is more comfortable for patients. Number 3. Magnetic resonance imaging, or MRI. This form of imaging can view the anatomy and the physiological processes and activities of the body. The sensors or the scanners here are a very big, strong magnets. These magnets are placed in the machine, and in the opposite side there is the image receptor, and the patient is placed in between. In dentistry, it is indicated to visualize TMJ and facial soft tissues. To take an MRI image, it can take from 15 minutes up to 2 hours. MRI has many advantages that are not available in other techniques. Firstly, no ionizing radiation means no biological hazards, makes it safer compared to other methods of imaging. The resultant image are available in all planes: axial, sagittal, and coronal. Superior soft tissue contrast. Actually, when you want to diagnose something in a soft tissue, the best way to go is the MRI. And most importantly, and what makes it unique, is the functional visualization of the active parts of the brain during certain activities. Some of the disadvantages of the MRI can be that it greatly depends on the patient, because if the patient moves, the whole process can be repeated. The machine is noisy. The magnetizing effect, because of the large magnet of the machine, makes it contraindicated to be used with patients with any metal artificial parts, like implants, like crowns, or even artificial metal joints. This is a usual X-ray image that shows a metal joint in the knee. Also, credit cards and other pieces of metals can be affected if placed near to the machine. The cost is quite expensive in this imaging technique, and it takes a long time, up to 2 hours. And of course, because the machine is closed, it puts the patient at the risk of claustrophobia, and that's why, as we said before, the patient can be offered a headset to listen to whatever they prefer, or a Google to distract them, or a low dose of a sedative medication. Number 4. Ultrasound. This imaging technique does not require the patient to be placed in a machine. Instead, a probe is used and it must come in tight contact with the skin or with the intraoral mucosa, and that's why a gel is used in between the probe and the skin or mucosa. This method is used to view salivary glands and soft tissue pathologies. As you can see in the photo, the extraoral handle is placed under the mandible and a gel is placed between the handle and the skin. It can be used to visualize the PDL as well. It can be used to visualize calculi or any obstructions in the salivary gland ducts. And here is the other handle, the small one that can be used intraorally to show any stones that could be present or any other soft tissue pathology. Number 5. Doppler Ultrasound. This is not quite an imaging technique, but the Doppler Ultrasound pen can be used to assess the blood flow in the teeth. It measures the difference between the transmitted and the returning frequencies, and that reflects the speed of the blood or RBCs inside the tooth, and then you can know if the tooth is vital or not. And that's why this method can be used as a tooth vitality test and also to assess the vascularity of any lesion. Laser Doppler flowmetry. Just to differentiate between this and the Doppler ultrasound. Laser Doppler flowmetry is also a method to assess the vitality of teeth. The laser probe is placed on the tooth and it measures the blood flow. But with laser, you should make sure that the teeth are isolated. Firstly, you use a silicone impression around the teeth with holes inside it to enter the laser probe, and you should protect the gingiva with a light cure gingival dam, just to make sure that the laser signals will not be disturbed. Number 6. Sialography. Sialography is a method to image the salivary glands and their ducts using any imaging technique like CT or CBCT, but after the infusion of a contrast medium to see the structure and the path of the ducts. It is indicated in case of diagnosis of the architecture of the salivary glands, to find any abnormalities, to show any obstructions or calculi in the ducts, or any inflammatory obstructions in the gland itself. It can also be used in TMJ diagnosis if there is any disorder, especially if the contrast medium is infused in the lower compartment. As you can see here, this is an X-ray image of the parotid gland, and the contrast medium is infused inside the duct, and that's why it can be clearly seen. In this picture there is a constriction, and that's why the contrast medium is not visible in this area, and in this picture you can see that there is a cut between this part and that part, meaning that there is a calculi or any kind of obstruction in here. To prepare the patient, firstly take a control image to view the radiopaque calculi if they are present. Secondly, the patient should suck a lemon or any secretory stimulant for 2 to 3 minutes. Then the symptomatic duct should be cannulated. Then you infuse up to 2 milliliters of the water-soluble contrast medium. After that, you take the radiograph, whether it's a CT or a CBCT, to see any constriction or obstruction. A major disadvantage of the sialography is that if the patient is allergic to the iodine or whatever contrasting medium you're using, the patient will be at risk of anaphylactic reaction. Number 7, the positron emission tomography, or the PET. It's a functional imaging technique. It uses a radioactive substances that are called radio tracers. These can visualize and measure any changes in the metabolic processes and other physiological activities in the live cells, like the blood flow, the chemical composition, and the absorption of the cells. The PET can scan and find any abnormal activity, and that's what makes it unique, because it's more sensitive than other imaging tests. You can think that it's like the MRI, a functional imaging technique. But the main difference here is that the PET discovers the abnormal activities or the malignant or diseased tissues and cells. This is the machine used. Here is an image for a brain. On the right you can see the regular MRI image for a normal and Alzheimer patient. On the left side you can see the PET scan of the normal brain and the diseased brain. There's always a shining yellow and red light in the diseased or the affected area. Also here, a CT scan for the tongue and a PET scan that shows a shining yellow light on this area that indicates cancer in the left side of the tongue. It can be used to early diagnosis of malignancies and also to follow up the treatment. Thank you. Don't hesitate to subscribe. I would like to have you here. And follow me on Instagram at Dentagenda for extra tips and tricks on every video.